Good morning students. Today's class we'll see the solved question paper of November 2020 of 2010 scheme. The first question is different parts of digestive system and describe them under the following head. For this you can refer 2018 question paper of 2016 scheme question number 2. Second is classify bonds according to the shapes with examples. Describe typical long bond under the following headings like parts covering the blood supply and applied anatomy. The femur is the only bone in the thigh and is the longest bone in the body. It acts as a site of origin and attachment for many muscles and ligaments. It can be divided into three parts: proximal, shaft, and distal. The proximal end have the head, neck, greater trochanter, lesser trochanter, and intertrochanteral crust. Shaft consists of borders like lateral and medial, surfaces like anterior, medial, lateral, ridges like lateral ridge, pectineal line, spiral line. Still in lateral and medial condyles, intercondyle fossa, lateral and medial epicondyles. The blood supply to the proximal femur is particular medical interest because of susceptibility to damage. So it is called trochanteric anastomosis, including the medial and lateral circumflex femoral arteries, that is the branches of the femoral artery, along with branches of superior and inferior gluteal arteries. The branches arising from deep femoral artery, that is also known as profunda femoris, also anastomose with the both circumflex femoral arteries as well as inferior gluteal artery to form cruciate anastomosis. They contribute to the anastomotic ring around the femoral neck. Rising from the anastomotic ring are cervical arteries that pierce the joint capsule to become reticular arteries. Distal end of the femur has a rich blood supply rising from popliteal vessels and deep perforators. Applied anatomy, neck of femur fractures. Femur fractures most vulnerable fracture site for the fracture occur. These fractures can be classified intracapsular or extracapsular. Femoroacetibular impingement is a mechanical disorder characterized by hip pain with active and passive movements, particularly flexion and rotation, as a result of contact between femoral head and acetabulum. The head of the femur may slip off the supporting neck. Thus, the term slipped capital femoral epiphysis was coined. The disorder is more commonly encountered pre-adolescent to adolescent males but can also seen in females. The bone classification, it is classified into long, short bones, flat, irregular, sesamoid. Covering of testes. The numbering from the deep to superficial, the covering are tunica vaginalis parietal layer, internal spermatic fascia, chiasmatum muscle and its fascia, external spermatic fascia, and dartos fascia of the skin. Diaphragm. Diaphragm is an upward curved C-shaped structure of a muscle and fibrous tissue that separates thoracic cavity from the abdomen. The superior surface is a dome-formed floor of the thoracic cavity and inferior surface is a roof of the abdominal cavity. There are a number of openings in the diaphragm through which the structures pass between the thorax and abdomen. There are three large openings: the aortic, esophageal, and the inferior vena cava opening, plus a series of smaller ones. Diaphragm is primarily innervated by phrenic nerve, which is formed from the cervical nerve C3, C4, and C5, while central portion of the diaphragm has sensory afferent via phrenic nerve. The peripheral portions of the diaphragm send sensory afferent via intercostal, that is T5 to T11, and subcostal nerves by T12. Blood supply. Arteries and veins above the diaphragm supply and drain the blood. From above, diaphragm receives blood from branches of internal thoracic arteries, namely pericardiophrenic artery and musculophrenic artery, from the superior phrenic artery, which arises directly from thoracic aorta, and from the lower internal intercostal arteries. From below, inferior phrenic arteries supply to the diaphragm. Diaphragm drains blood in the brachiocephalic veins, the zygous veins, and veins that drain to the inferior vena cava and left suprarenal vein. Applied aspects, there is paralysis. If either phrenic nerve, cervical spine, or brainstem damage is then severe, the nervous supply to the diaphragm. The most common damage to the phrenic nerve is by bronchial cancer, which usually affect the one side of the diaphragm. Other causes include Guillain-Barré syndrome and systemic lupus erythematosus. Herniation. The hiatus hernia is the hernia common in adults which is parts of the lower esophagus or stomach that are normally in the abdomen pass bulge abnormally to the diaphragm and present in the thorax. Imaging. Due to its position separating the thorax and abdomen, fluid abnormally present in the thorax or air abnormally present in the abdomen may collect the one side of the diaphragm and X-ray may reveal this. Tympanic membrane. Tympanic membranous meningia is a thin, cone-shaped membrane that separates external ear from the middle ear. Its function is to transmit the sound from the air to the ossicles inside the middle ear and then to oval window in the fluid-filled cochlea. Hence, it ultimately converts and amplifies vibration in air to vibration to the cochlear fluid. The malleus bone bridges the gap between the eardrum and other ossicles. Sensation of the outer surface of the tympanic membrane is supplied mainly by auriculotemporal nerve, a branch of mandibular nerve, which contributions from the auricular branch of the vagus nerve, the facial nerve, and possibly the glossopharyngeal nerve. The inner surface of the tympanic membrane is innervated by glossopharyngeal nerve. The tympanic membrane is comprised of three layers of tissue: the outer cutaneous layer, fibrous middle layer, and layer of mucous membrane on its innermost surface. The membrane is held in place by a thick ring of cartilage, a tough but flexible kind of tissue. The tympanic membrane's function is to assist in human hearing. When the sound waves enter the ear, they strike the tympanic membrane. The membrane vibrates and force of the sound waves strike and transmit the vibrations further to the bones of the middle ear. Patients with ruptured or absent tympanic membrane have extreme difficulty in hearing and possibly even incomplete hearing loss. Applied aspects: rupture. Unintentional perforation or rupture has been described in blast injuries and air travel, typically in patients experiencing upper respiratory congestion that prevents equalization of pressure in the middle ear. Surgical puncture for treatment of middle ear infection. The pressure of the fluid of an infected middle ear into the eardrum may cause to rupture. Usually, this consists of a small hole or perforation which allow the fluid to drain out. This does not occur naturally. A myringotomy can be done. Abdominal aorta. Abdominal aorta is the largest artery in the abdominal cavity. As a part of aorta, it is a direct continuation of descending aorta. Abdominal aorta begins at the level of diaphragm, crossing it via the aortic hiatus, technically behind the diaphragm at the vertebral column of T12. It travels down the posterior wall of the abdomen anterior to the vertebral column, and this follows curvature of the lumbar vertebra, that is the convex anteriorly. The peak of this convexity is the level of third lumbar vertebrae. It runs parallel to the inferior vena cava, which is located just to the right of abdominal aorta and becomes smaller in diameter as it develops branches. This is thought to be due to the large size of the principal branches. At the 11th rib, the diameter is 122 mm long and 55 mm wide, and this because of the constant pressure. Abdominal aorta clinically divided into two segments: suprarenal abdominal para-visceral segment inferior to the diaphragm but superior to the renal arteries. Infrarenal segment inferior to the renal arteries, superior to the iliac bifurcation. Relations: abdominal aorta lies slightly to the left of the middle of the body. It is covered anteriorly by lesser omentum and stomach, behind which is branches of celiac artery and celiac plexus. Below this are the lineal vein, that is splenic vein and pancreas, left renal vein, inferior part of the duodenum and mesentery, and the aortic plexus. Posteriorly, separated from lumbar vertebrae and intervertebral by fibrocartilages by anterior longitudinal ligament and left lumbar veins. On right side, it is relation above the esophagus vein, cisterna chyli, thoracic duct, and right carcass of the diaphragm, the last separating it from upper part of inferior vena cava, and from the right celiac ganglion. Inferior vena cava is in the contact with the aorta below. The left side are the left carcass of the diaphragm, the left celiac ganglion, ascending part of duodenum, and some coils of the small intestine. Lymph node, it has been described in a 2018 question paper. Relations of urinary bladder. Apex of anterior angle connect the umbilicus by a fibrous cord called brachus. Neck of the inferior angle continues to the urethra. The rest of upper surface prostate in males and upper surface of urogenital diaphragm in female. Superior surface covered by peritoneum. It is related to the coils of small intestine. Infralateral surface related to the muscles of the pelvic floor. Posterior surface, the male upper part of covered by peritoneum and related to the rectovesicular pouch of the peritoneum which coils ileum, and the lower part of posterior surface related to the seminal vesicles and vasa differentiata. In female, it was posterior surface related to the anterior wall of the vagina. Supralateral surface of the cerebral hemisphere. Supralateral surface of the cerebral cortex marked with the striking figures of the cortex, frontal lobe, temporal, parietal lobe, occipital lobe, and insula. The frontal lobe. The frontal lobe is defined on the surface by the fissure called central sulcus, which runs downwards and forwards towards the second fissure called lateral sulcus, which also defines this lobe. Temporal lobe. This lobe defined to the supralateral surface of the lateral sulcus and inferior temporal sulcus. It has two sulci that runs parallel to the posterior ramus of the lateral sulcus, which is the third branch originating from the stem and lateral sulcus. Posterior lobe. This lobe defined on the superlateral surface of the central fissure anteriorly and parieto-occipital sulcus posteriorly. The parieto-occipital sulcus is joined to the inferior temporal sulcus by imaginary line. Occipital lobe. This lobe defined anteriorly by parieto-occipital sulcus, the first imaginary line, and upturned posterior end of the inferior temporal sulcus. Insula. Insula is the Latin word meaning hidden. As the name implies, it is the part of cerebral cortex that does not belong to any of the four lobes described above. It is located deep in the stem and posterior ramus of the lateral sulcus. Neuron. Neuron has been discussed in 2019 question paper. Sciatic nerve also has been discussed. Coronary arteries. The coronary arteries are the blood vessels of coronary circulations which transport oxygenated blood to the heart muscles. The heart is in continuous supply of oxygen to function survey, much like other tissue or organ of the body. The coronary arteries wrap around the entire heart. The two main branches of left coronary artery and right coronary artery. The arteries can additionally be categorized based on the area of the heart they provide circulation for. Narrowing of the arteries can be caused by process known as atherosclerosis, arteriosclerosis. This occurs when plaques made up of cholesterol and other substances build up over a time in the walls of arteries. Coronary artery disease or CAD or ischemic heart disease are the terms used to describe narrowing of coronary arteries. This is a picture of coronary arteries. The aorta give rise to LCA or left coronary artery and right coronary artery. Left coronary artery is give rise to left anterior descending and circumflex and posterior descending and diagonal branches. So these are the branches of the coronary artery. Histology of skin. Skin covers the outer surface of body and is the largest organ. Skin is the accessory structure like hair, sweat glands, sebaceous glands and nails made up of the integumentary system. Its primary function are to protect the body from the environment and prevent water loss. Here are three general layers of the skin, that is superficial to deep, are epidermis, dermis and hypodermis. Epidermis is the uppermost layer of the skin going from deep to superficial, consists of 5 layers: basal layer, prickle layer, lamellar layer, fierce layer and cornified layer. Deep to epidermis is the dermis. The region is irregularly arranged and filled mostly with the connective tissue. It lies deep into the basement membrane, the stratum basale. Hypodermis. Finally, the dermis rests on the layer of loose connective tissue known as the hypodermis. It is a superficial facial sheath with interspersed adipose tissue. Greater saphenous vein. Greater saphenous vein, alternately known long saphenous vein, is the large subcutaneous superficial vein of the leg. It is the longest vein in the body, running along the length of lower limb, returning blood from the foot, leg and thigh to deep femoral vein at the femoral triangle. Great saphenous vein originates from well dorsal vein to the big toe and merges with the dorsal venous arch of the foot. After passing in the front of the medial malleus, wealth often can be visualized and palpated. It runs up the medial side of the leg. At the knee, it runs over the posterior border of the medial epicondyle of the femur bone in the proximal anterior thigh 3 to 4 centimeters infralateral to the pubic tubercle. The great saphenous vein gives down the deep through the pubiform fascia of the saphenous opening to the femoral vein. It forms an arch, the saphenous arch, to join common femoral vein in the region of the femoral triangle at sacro-femoral junction. Pathology of great saphenous vein relatively common, but its typical isolation but not life-threatening. The varicose veins, thrombophlebitis. Great saphenous vein can thrombose. This type of phlebitis of the GSP usually not life-threatening. Thank you for listening.